The medical events of 1985 claim a breakthrough for the safety of the blood supply in the fight against transfusion-associated AIDS, acquired immune deficiency syndrome. To date, more than 12,000 people in the United States have AIDS. About 2% of them contracted it through blood transfusions or use of blood products such as factor VIII, which is used by hemophiliacs. Here at the Red Cross Transmissible Disease Laboratory, just outside of Washington, D.C., a new testing procedure is being used to detect the presence of the AIDS virus in donated blood. This test helps the Red Cross maintain the safety of the nation's blood supply for those people who need transfusions and blood products.
About 3.5 million people are transfused in the United States every year. To date, there are about 202 reported cases of AIDS caused by transfusion, but the incubation period for the disease is about 5 years, so this represents a total of about 16.5 million patients who've been transfused over that period. The problem is to make sure that the donated blood is as safe as possible to protect the current and future recipients of blood.
What has the Red Cross been doing to protect the blood supply from AIDS?
Well, the Red Cross has always screened donors, asking them about their health, whether or not they've had hepatitis, been exposed to hepatitis, other infectious diseases, such as malaria. But in 1983, the United States government, recognizing the problem of transfusion-associated AIDS, asked that additional screening procedures be introduced, and from that time the Red Cross specifically asked donors about exposure to AIDS, whether or not they had any symptoms relating to AIDS, and also the Red Cross required that individuals who were in a risk group for AIDS, that is sexually active male homosexuals, hemophiliacs, intravenous drug addicts, and the sexual partners of such individuals should voluntarily self-defer or refrain from giving blood. More recently, the Red Cross has implemented a test which will identify individuals who have indeed been exposed to AIDS. It's very important to recognize that this test does not diagnose AIDS, it merely indicates that a person who's been exposed to AIDS at some time in the past. We don't know whether those individuals are currently sick or will ever get sick. Another problem is that of all of the positive tests, only a small proportion actually represent true exposure to the AIDS virus. Some of the positive tests are indeed false positives.
Of the blood donated to the Red Cross this year, how many units will show positive for AIDS?
Currently, of the 6 million units that we collect, we're expecting that about 6,000 will have positive tests. But of these, only about a quarter, or 1,600, will in fact represent individuals who have truly been exposed to the AIDS virus.
What are the results? What's next? An article printed in the New York Times states, "Blood supply called free of AIDS. A new test has apparently succeeded in screening AIDS-tainted blood from the nation's supply of blood for transfusions. The test picks up essentially every potentially infectious unit of contaminated blood." Now that we have pretty much solved the transfusion-associated AIDS cases, we have to work to control the remaining 98%. Efforts are now underway to make the test even more accurate. The number of transfusion-associated AIDS cases, which now stands at 202, will probably continue to rise until the test program takes effect. The availability of a blood screening test is progress. While it cannot help those people who have AIDS, the test can provide protection for the 3.5 million people in the United States who receive blood transfusions or blood products each year. The work on AIDS continues. It is an important part of the Red Cross commitment to the nation's blood supply, to the volunteer donors, and to the people who need blood and blood products.